frankly. So, what about this myth? Food triggers CU.
Well, I think that is a great topic just for us to briefly discuss. So it is understandable to wonder about foods. It's also very natural to look for a cause when symptoms are so disruptive as they are. You articulated very well, Kristen, and that's why we're so great. It's great for us to have you as our executive director. Your journey and how you really, kept looking and looking. But to dovetail on what Dr. Bernstein said, that the predominant, certainly the predominant number of cases are not contributed by food. Although food can cause hives, we see a true food allergy as causing more immediate and reproducible symptoms. So Dr. Bernstein also touched on, other triggers which would need to be considered, including stress, temperature changes, illness, viruses, medications, and the like. So I think all of this really points to the importance of accurate diagnosis. And I think it is so very important for those listening, perhaps haven't yet started their diagnostic journey. And so we hope to give you information that will really empower you today to, reach out and say, okay, I'm ready to get a diagnosis. Because I'm sure, Kristen, you can attest to that, though the end result for you personally was that there was no identifiable trigger or was idiopathic, the journey of ruling out things helped reduce the stress, right? Because when patients carry unnecessary and inaccurate diagnosis, it really impedes on their quality of life. It adds burden in and of itself. So, I think when we look at, this starting the diagnostic journey that that we're discussing here, the listener of this webinar, really are in the most important position. You're driving the car initially when you have that encounter, in as much that your medical history that you can bring in, let's say that Dr. Bernstein has a patient tomorrow, right? If that new patient can come in with as much medical history, it makes what he does, that much sharper, more defined, et cetera, and sometimes can actually expedite that diagnostic journey. So just want to encourage everyone, for those of you who've not yet sought an allergist, that when you do, be sure to take, a note on your phone, or you're taking pictures of things, asking family recall, because thinking 6 weeks back, I mean, we often can't remember what we ate for breakfast this morning. So, thinking 6 weeks back, we often have to encompass the people we live with, perhaps coworkers, something along that line.